Hi, Dr. Mill again, Mini Health Talk to get you healthy again. Today, we're going to talk about PSA and its Chinese medical treatment. PSA is prostate specific agent. Next page. PSA is a prostate specific agent. Is a protein produced by normal as well as malignant cells of the prostate gland. The normal range is below 4 nanograms per milliliter. So what causes the PSA elevations? There are mainly three things that change to the prostate. Number one is BPH, is benign prostate hypertrophy. Number two is a prostatitis, the inflammation of the prostate, sometimes the pain and irritable urination. Number three is prostate cancer. So what's the PSA level means? Usually a PSA level in the abnormal range 4 to 10 nanogram per milliliter may be benign prostate hypertrophy or prostatitis. Usually, I prefer the urologist to done the DRE, digital rectal exam first to all the PSA elevation patients. PSA above 10 nanogram per milliliter may be prostate cancer. DRE. So acupuncture treatment plan should be restore the male reproductive system. So each time we're going to talk about the acupuncture treatment plan, the therapist always want, oh, what's the point? What's the point? You have to remember, you are not just a therapist, you are a doctor. So the plan is means whatever you do and the patient do together to make patient improve their prostate health. Number one, should have a sexual intercourse once a week to let the sperm out. When the sperm retain in the testicles, in the prostate areas, it can cause a lot of issues. Number two, drink plenty of water to flush the urinary system to reduce the irritation to the prostate. Number three, ankle exercise to drain the toxins in the lower body. If you don't know where it is, you should go to my Mini Health Talk channel to find the ankle exercise, how to drain the toxins in the lower part of your body or to your patient. Then reduce the stress level to sustain a healthy hormone level. Any kind of stress that will mess up the hormone system and cause a lot of issues, include the prostate health issues. Then the point selection. As an acupuncturist, the point selection you should be considered as the last because you're the therapist. You need to work together to work with the patient and make sure they have the lifestyle change on the above this area, and then the point. Because this takes about 60%. The acupuncture treatment will take 40% of the healing of the prostate health. 20 selections, do 20, 四神聪, 鼻尖, Ren 24 to raise up qi levels. Then 妇科环槽, penis, this is Richard Tan's points. 子宫, Ren 6, Ren 4, and kidney 3-6 to balance the hormones. 3 yellows, Sanyo 5, spleen 6 to drain the toxins. Chinese herbal therapy, the principle is the same like acupuncture point selections. Number one is 桂枝茯苓丸 to reduce the overgrowth of the prostate. Number two is 五子衍宗丸 to balance the hormones. Most of the traditional treatment for the prostate issues, they try to give the female hormones to counteract male hormones. I find that in the clinic that's wrong. I tried that to some patients. They didn't lower their prostate PSA. But when I tried to use a 五子衍宗丸, which traditional designed to help the male to improve their fertilities and help the prostate health the most. And then the 四逆汤 to strengthen the heart, to eliminate the toxins. It's so important to know that our heart help the whole body system to get the nutrition in the cells and to take out the toxins out of the system. If the heart is weak, the whole body can become unhealthy, including the prostate. So strengthen the heart, especially when you see the patient's sublingual vein dilation so strong, the strengthened heart is very important. You can increase the dosage of it. Bhajan San to clear the urinary pathway, any kind of irritations in the urinary system, you should use the Bhajan San. Yin Qiao San, I like to use the Yin Qiao San in my urology practice because Yin Qiao San, it clear the upper respiratory induced autoimmune reactions. This is great for any kind of kidney or prostate issues induced by the upper respiratory induced autoimmune reactions. As far as you follow the treatment plan, 98% of the patients should recover, be able to lower their PSA level within 3 to 6 months. Next one. Now let's do a case study and see what I do in my daily practice to improve my patient's PSA health. Let's use this patient as an example. A 68-year-old white male came to my clinic on November 12th with PSA elevation of 10.8 nanogram milliliter, whole body ache, weight loss to 152 pounds, muscle loss, fatigue, night sweating, poor sleep, frequent urination, wake up to urinate 2 to 3 times per night. History of genital herpes, and the patient also have ED. She cannot have erections. Sublingual was dark tongue with bruises. You can see the blood leakage and the sublingual, and genital areas enlarged with bruises. That's usually either shows enlarged prostate or prostate cancer. That's a sign of it. And underside vein dilation was 3rd degree. So when you see a patient underside vein dilation 3rd degree, it's always a great idea to give them heart strengthened points and heart strengthened herbs. Very weak pulse. Next page. My initial diagnosis was blood stenosis with heart and kidney deficiency. So my treatment plan is the same to clean up the blood stenosis and tonify the kidney and heart. The acupuncture appointment follow the PS treatment plan. You always, acupuncture treatment, you always have to follow the treatment plan and give the patient advices how they modify their lifestyle so that they can flush the toxins and get a healthy prostate. And plus the point 20 四神聪 Run 24 妇科环草 penis 子宫 Run 643 3 yellows stomach 36 kidney 6. Herb I started with 四鸡汤 40 grams because he has obvious heart weakness because sublingual vein dilation was a 3rd degree. 五子衍宗丸 30, 桂枝茯苓丸 30. Next page. So on December 15th, his weight gained to 160. So that's very impressive. His patient was very happy, and he and his wife so happy. They were thinking they have prostate cancer. He's gonna die because of such a dramatic body ache, the weight loss, and PSA elevation. It shows very early signs of prostate cancer. And with my treatment, the weight came back, and the PSA on December 15th was lowered to 9 nanogram per milliliter. Patient is able to have erection and ejaculations, although it's not strong enough to have a good sexual intercourse, but he could have erection and ejaculation. I changed the form to 桂枝茯苓丸 40. You see, I used to use 四逆汤 the most. Right now I change the 桂枝茯苓丸 the most. I try to improve, and right now I'm focused on improve the prostate health. 五子衍宗丸 30 and 四逆汤 30. So we still try to balance hormone strength heart, but we're focused on to improve the prostate health. On January 7th, his weight gained to 171 pounds, PSA levels 8.1 nanogram per milliliter. So such a great improvement step by step. Patient's body aches gone, so whole body aches gone, energy is better, no night sweating, and is able to perform this satisfactory sexual intercourse. Next slide. So conclusion, PSA elevation is an indicator of prostate changes. A full prostate evaluation should be proceeded. Biopsy should be the last resort because it has so much negative impact to the patients. Acupuncture and Chinese herbal remedy should be first adopted to improve the patient's prostate health and general health. So I want to thank you again to join me for the mini health talk to improve your health. If you're a practitioner, is to improve your patient's health. If you like my program, please give me a thumb up and also subscribe to the channels. Thank you again. We'll see you next time.